aminoglycosides. So we are observing the slides. Hello.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, thank you. So aminoglycosides we will learn because aminoglycosides, the first name to remember in aminoglycoside is gentamicin. So the aminoglycosides are one of the antibiotics. You may ask, you are teaching so many subjects. You are teaching the beta lactams, then macrolides, and so many. Why so much class of the antibiotics are there? Because we have the drug resistance in the field condition, and also we want the specific drugs to specific type of the bacteria. That's why we are studying the different antimicrobial agents. That's also the aminoglycosides are also one of the important antimicrobial agents or the drugs. So these aminoglycosides are also called as AMINOCYLITOLS. That's the another name. And these are the group of the natural and semi-synthetic antibiotics having amino sugars linked to the aminocyclitol ring by glycosidic bond. So here you can see on the right side. So there are two aminocyclitol rings are there. Then they are bridged by a glycoside bond. So that's why they are called as the aminoglycoside. So if you remember this thing, you can easily memorize, because it is sometimes very difficult to memorize everything, but only by repeated readings, nothing else, repeated readings, then you can find. So even after 35 years also, we also forget sometimes the names and other thing many times, but by recurrent teaching and other thing, we are trying to understand this thing. Still it is not like that. So the glycoside bond is there, then that is the two aminocyclitols. So they are mostly bactericidal. So the penicillins are bactericidal, tetracyclines static, then macrolides are also static, and chloramphenicol static. So they are also bactericidal drugs. Cidal means they are going to kill the bacteria and share chemical and pharmacological properties and have similar antibacterial spectrum and toxic effect. So the important members of this class include, please remember, it is starting from the gentamicin, here the gentamicin. So everybody, I remember this thing as the gentamicin, then kanamycin, neomycin, streptomycin, and then amikacin and tobramycin. All these are the aminoglycosides. So once you should not erythromycin, is it a aminoglycoside? You should not have the confusion. Erythromycin is a macrolide antibiotic. So the mechanism is totally different. So the streptomycin, neomycin, kanamycin, gentamicin, amikacin, and tobramycin. These are the very commonly used drug in the veterinary field is concerned, or else there are hundreds of drugs are there. So if you remember this thing, that's enough. Then coming to the little history part of this aminoglycosides is, so streptomycin was the first member. So you should remember all these things, history, who invented XYZ antibiotic, in which year, and also especially in case of chemotherapy, you need to remember the history. In case of I am putting the slides of the history, then you should know this man, Waxman. So the first member of the aminoglycoside antibiotic is derived in 1944, and the Waxman and co-workers. So he is the founder of the streptomycin, and it's also from the Streptomyces griseus. So you please prepare a chart, especially in the chemotherapy, which are the microorganisms yielding which antibiotic. Penicillium notatum, penicillin, like that. Streptomyces griseus, that's the streptomyces. Or like this, many streptomyces species yielding so many other erythromycin also. Then the neomycin was next to the isolated in 1949, followed by the kanamycin, neomycin and kanamycin, and also the gentamicin. So here, please see the spellings very carefully. Kanamycin, M-Y-C-I-N. Here it is gentamicin. These are the correct spellings. Later I will tell why, how the spelling is going to change. So the MYCIN and MICIN in 1963. So streptomycin, here MY, neomycin, kanamycin, and amikacin. So especially the antibiotics which are synthesized are usually MI and natural kanamycin, but this is not a strict phenomenon. So amikacin is the first semi-synthetic obtained by the chemical modification of the kanamycin. So if you ask the question which is the first synthetic amino acid, don't write the streptomycin. So it is amikacin. Naturally originated first aminoglycoside antibiotic is streptomycin. So this AGs means aminoglycosides. They have many members and some are extensively used in veterinary practice, especially the gentamicin and streptomycin. Of course, the streptomycin is highestly used to the extent of highest because it is always used in the combination with the streptopenicillin or the dichrysticin, one of the most popular trade name. I think it is one of the largest selling drug, especially after this tetracyclines are concerned. And coming to the little chemistry, I am not going into the deep of anything, but not too short also, because as undergraduate students, you should know few of these things, because when you are doing the master degree or the prosecuting for the PhD directly, then these are all be useful. And aminoglycosides consists of two or more amino sugars joined by the glycosidic linkages to the hexose nucleus. That's what we have seen in the earlier picture, hexose nucleus. Here it is there. So the two aminocyclitol rings are joined by the glycosidic linkage. That's why they are called as the aminoglycosides. So the streptomycin, the hexose molecule is 2-deoxystreptamine. So here all there. Later I am going to show you the picture, and please memorize this thing. So presence of amino NH2 group. That's why the name this aminoglycoside NH2, if it is there, that is a amino group. So aminoglycoside means amino group is there, NH2, then the aminocyclitol rings that are there, then they are joined with the glycosidic linkage. That's why the name aminoglycosides. So the amino group, especially NH2 group, in the structure imparts basic nature. These are all the basic drugs. And the hydroxyl group on the sugars provide high water solubility. OH group which is present, they are going to produce the high water solubility. They are very, very poor lipid soluble drugs. Whereas the chloramphenicol and macrolides are having very high lipid solubility. So the drugs which have got the high lipid solubility, they are absorbed very easily from the intestine, whereas the water soluble drugs are not properly absorbed. That's why you should know the chemical property. If OH groups are removed, like tobramycin, the drug becomes more active. Then because of the groups can be substituted at more than one position on the molecules, several forms of the same aminoglycosides may be obtained, because the structure activity relationships are there here. And before going to the next slide, please see this particular slide. In this particular slide, entire what you call as the features of this aminoglycoside is there. So starting from the aminoglycoside uses, yes, they are always used along with a cell wall synthesis inhibitor, that is the penicillin plus streptomycin. It is not a universal truth, but usually penicillin, because these are the narrow spectrum antibiotics. So these are used along with the another antibiotic which is effective against the gram-positive bacteria, because most of the aminoglycosides are effective only against the gram-negative bacteria. Penicillin gram-positive, this is gram-negative. So the starting from the first will come. It is the routes of the administration are only IM, IV, and topical. Here there is no oral routes, because orally these drugs are not absorbed. Amino, not oral. Like that you can. So you remember some mnemonics, then you can remember. So oral neomycin before elective bolus surgery is not done. Usually the amikacin is not absorbed orally, whereas the surgery of the intestine to kill these germs, especially in the intestine. So the pharmacokinetics, volume of distribution, 25% of the body weight. So the adjust maintenance dosing and mechanism, we will see it is going to irreversible inhibition of the 30S. So very short it is there, 30S subunit. Yesterday we have learned, especially macrolides, 50S subunit of the microsomes. So that's the bactericidal, whether it's a bacteristatic or cidal, it is a bactericidal drug. So this will be useful in case of the urinary tract infections. Then the topical ointments are also there, like tobramycin ointment. This is especially used for the skin infections. And then bacteremia, especially the aerobes only, that is gram-negative aerobes. The endocarditis, it is used, pneumonia, of course, the methicillin resistant staphylococcus aureus pneumonia, and especially the upper respiratory tract. The important and greatest side effects are the ototoxicity and nephrotoxicity and the neuromuscular blockade. That is the high dose. So, and also in case of pregnancy, some adverse effects are there. So this is the very, very short gist of the aminoglycosides. Anyway, coming to the structure activity relationship of the particularly the sulfur, this aminoglycoside. So the neomycin is a mixture of neomycin C and the phridimycin, and gentamicin is a complex of, gentamicin is having C1, C1A and C2. So three moieties are there, and the minor differences in the chemical structure of these drugs may lead to differences in both efficacy and toxicity. You know very well, we are all not the chemical engineers or the pharmaceutical persons, but we should understand the minimum basic things, especially about the chemistry. And most aminoglycosides are obtained by natural fermentation, especially from different species of the Streptomyces. So as the Streptomyces griseus, Venezuela, and so many the Streptomyces species are there to yield the aminoglycosides naturally. And some are prepared from the actinomycetes like Micromonosporium, etc., Micromonospora perfura, and many more are there. And the aminoglycosides derived from Streptomyces carry the suffix mycin. So I was pronouncing the streptomycin, MYCIN, whereas gentamicin is MICIN. So you should see the aminoglycosides derived from the Streptomyces carry the suffix mycin, whereas those obtained from the Micromonospora have the suffix mycin, because the gentamicin is obtained from the Micromonospora species, it is gentamicin, whereas the Streptomycin is derived from Streptomyces griseus. That's why the mycin. Hope you have got the point very clear. Then there is a small video about the structure activity relationship of the amino acids, especially. Then there is the amino acid, especially these have the aminoglycosides have got different structural features, like a central ring is there. Then it is followed by 1,3-diamino hexane ring. This is the amide moieties, and the positions, please see 1, 2, 3, 4, 5, and 6 moieties are there. So the thing is, these are all the NH2 moieties are here, especially these can be changed in the side chain, and also the different moieties which are present here can be adjusted. So here the amino sugars, especially the hexose or the pentose, are also available here. Then, so here this is here amino sugar moiety is attached, and the common structure of this aminoglycoside is with the NH2 moiety, 3 NH2 moiety, and 1 CH2 moiety is present. And please note down, these are all the position 1, 2, 3, 4, like that in the anti-clockwise direction it is going. So 1 here, 2 here, 3 here, and 4 here, and 6. So this is anti-clockwise position, and in Roman there are 1, 2, and 3 numbers are there. So these are all the positions where different side chain modifications are also there, and the oxygen moieties will be present in between the different groups, especially first, second, and third group. That's how the different classes of the aminoglycosides will be derived in different stages. So these drugs, especially these side chains, these the ring at the sixth position, 1, 2, 3, 4, 5, 6, especially this type of the ring, it causes the structure activity change, especially the one which is causing. So here the amide moiety is attached, and the 6 amino group increases the activity, especially the antibiotic activity. So this is the target for inactivation by the enzymes which are secreted by the aminoglycoside enzymes, destroying enzymes, especially by the bacterial enzymes, many of the resistance. And CH3 substitutions causes the inactivation, decreased inactivation by the bacteria, whereas the 2 amino group increases the activity of each drug. So the second generation and other things are this, especially the kanamycin, there will be an H2 ring on the position 6 here, then position 2nd here. So kanamycin is having 3 moieties, B, A, and C. So accordingly, the structure activity, the OH is not essential when it is inactivated by the phosphorylation. So the structure activity of the ring 2 we'll see. So this is the ring 2 what we have seen, and the activation retains the activity, especially the amide activation, and resistance for inactivation by C2H5 group. Especially the ring structure makes lot of difference, and this 4 amino 2 hydroxybutanol, especially it yields the amic acid, is one of the most potent among the antibacterial group, especially in the position 2 with hydroxyl group increases the resistance to the especially to the bacterial resistant bacteria. So target for acylation thereby activated, and removal of the NH2 group increases the bacterial resistance. So that's how it goes.
So this is the second position.
So here the second position.
Just like the ring one, here again, amino group is the best group, which is simple hydrogen. But the second position is the NH2 group. Similarly, at the third position. So what is that?
So because all the positions, if it is going to be changed, and it yields different aminoglycoside, antibiotics are concerned. So whenever we are classifying the different classes of amino acids, and all these structures are being useful for us. So the properties of these groups, especially the members of aminoglycoside antibiotics, do consist some common properties, and the number 1 is the polar, means water soluble. So polar means always it is water soluble, and generally ionized in solution. So they are more and more ionized in solution. That's why they are not absorbed orally, and distribute only extracellular, though they are not going inside the bacterial cell, because the nature of this drug is they are water soluble and ionized, whereas the fat soluble and non-ionized form of the drugs are highly penetrating inside the cell and undergo limited biotransformation and excreted mainly unchanged in the urine. So whereas the macrolide antibiotics, yesterday we have learned to remember the thing is, especially the pharmacokinetics, the most of the macrolide antibiotics, yes, they are partially absorbed after oral administration, 60 to 90%, whereas here there is no absorption at all. absorption at all, zero absorption, because these are water soluble. The bactericidal in action are most active against the gram-negative bacilli. So especially they are effective against the gram-negative bacilli, and newer agents, especially the tobramycin and the drugs, especially cizomycin and many more, have the broadest activity also, and penetrate poorly into the mammalian cells and are of limited value in infections caused by the intracellular bacteria. So if the bacteria is causing intracellular infection, just like the brucellosis and also the tuberculosis, these are all the intracellular infections, and this will not be affected by the especially aminoglycoside antimicrobial drugs. So they act by interfering with the protein synthesis in susceptible bacteria. So whereas the 50S was inhibited by the macrolides, and elongation of the polypeptide chain which is attached to the 50S subunit was done, especially in case of the macrolides, whereas here it is going to bind with the 30S, and we will see in detail. So mainly used as the sulfate salt, just like gentamicin sulfate, streptomycin sulfate, tobramycin sulfate, like this, which are highly water soluble. So this is one of the advantage and disadvantage also at the same time. And coming to the chemistry, just have the overlook of this thing. Amino sugars are combined with that of the 2-deoxystreptamine, especially, and another amino sugar. Two amino sugars are joined with 2-deoxystreptamine, and it forms the aminoglycoside structures. Whereas the streptomycin is the streptidine is a amino sugar, and streptose amino sugar and N-methyl-L-glucosamine amino sugars, they are all formed for the streptobiosamine, and this is the basic ring of the streptomycin. Whereas the aqueous solutions of the aminoglycosides are stable for months. That's why they are having the alkaline pH, just like the macrolides. They have got the alkaline pH. So they have caused the ototoxicity because they are going to damage the 8th cranial nerve. So, and the nephrotoxicity, because 8th cranial nerve is the one which is related to the hearing, and they have very narrow margin of safety, means they are highly toxic. Narrow margin means highly toxic. So the bacterial resistance also developed very rapidly. Then, however, an organism resistant to one aminoglycoside still respond to other. That is a very important thing to remember. Suppose in case of beta-lactamase, these antibiotics, if it is resistant to one, then it will be resistant to all classes. So this type of cross resistance is not existing. So this is a partial resistance here, because the microorganism is resistant to one, cannot transmit to the other type of the bacteria, and show synergistic antibacterial effect with beta-lactam antibiotics. Especially the streptomycin is combined with the penicillin. That's why it's called as the streptopenicillin. And very high concentrations may complex with beta-lactam antibiotics, resulting in lot of the activity. So very high doses should not be mixed. That's how the general properties. So here, whenever especially in the susceptible bacteria, that's also the extracellular bacteria, because this drug is unable to enter inside the cell, and these are all the extracellular bacteria. So what happens? The aminoglycosides penetrate cell membrane through aqueous pores, which is present on the bacterial cell membrane. Especially the gram-negative bacteria will have the cell membrane, and the cell wall is very thin there, and they reach the perisplasmic stage, especially the cytoplasm of the bacteria, and taken up by the active transport into the cells. Once again, it may require some energy, and these all bind with the 30S ribosome subunit, and because of this thing, the protein synthesis in very broad sense, it will be inhibited, and block initiation of protein synthesis and inhibit protein synthesis. So And because of these things also 30S is inhibited, then the nonsense, these amino acids will be added. Instead of adding the regular amino acids, the transpeptidase enzyme will bind the amino acids which are the unnatural amino acids. So because of this thing, the protein synthesis will be inhibited. That's why it ultimately causes the bactericidal action. So this you please remember, a very simple step how we can remember the mechanism of action of aminoglycosides. So aminoglycosides, always remember, this it is going to act on the 30S ribosomal subunit. And classification, please remember, make your own mnemonics, how to remember all these things. And based on antibacterial spectrum, they are classified into the narrow spectrum aminoglycosides like streptomycin and dihydrostreptomycin. So these are the oldest class of the antibiotics in the particular group. So it is derived from Streptomyces griseus. So these are all the narrow spectrum because they are only effective against gram-negative arrows. Then the broad spectrum aminoglycosides like the neomycin. So you know the criteria, these are all derived from the Streptomyces species. Pramycetin and kennamycin and paromomycin, then arbacacin. So arbacacin, as the name indicates, it is synthetic. Whereas the extended spectrum aminoglycosides are little, these are also having the action on the gram-negative bacteria. So the names are the gentamicin. So you please see here, this all are the spellings: amikacin, tobramycin. Once again, it is from the Streptomyces species, and sisomycin and netilmycin. So netilmycin, all the extended spectrum aminoglycosides end up with the MICIN. So these are derived from the Streptomyces species, whereas the others, these are not derived from the Streptomyces because they are all derived from the Micromonospora species of the actinomycet tails. Whereas the tobramycin, once again from the Streptomyces species. So please remember the classification. The first is narrow spectrum. The examples are the streptomycin and dihydrostreptomycin. Whereas the broad spectrum aminoglycosides are the neomycin, pramycetin, then kennamycin, paromomycin, and arbacamycin. Whereas the extended spectrum aminoglycosides are the gentamicin, amikacin, tobramycin, MYCIN, and sisomycin and netilmycin are the examples. So only in the third generation or extended spectrum, you will get these mycins, MICINS. So this is another thing. So there are varieties of the these classification techniques are there. This is from the book. This especially the book, especially this Goodman-Gilman's book. The classification is systemic aminoglycosides and topical aminoglycosides. Only two classes they are going to make, and you can remember the earlier one only because it is easy to remember. Or else you can also remember this thing, the topical aminoglycosides, just neomycin and this pramycetin, NF for topical amino acids. Whereas the systemic aminoglycosides, especially parenterally, these need to be administered like the streptomycin, then gentamicin, kennamycin, tobramycin, amikacin, sisomycin, then netilmycin, and also the paromomycin are the examples of systemic aminoglycosides. Whereas the aminoglycosides which are only used in the ointments like ophthalmic ointments, drops, etc., are the neomycin and pramycetin. So pramycetin is available as the sopramycin eye ointment, this dermal ointment. Then this is the way how we can remember the aminoglycosides mnemonics. So this is just to remember some. If you go to the Google and search the aminoglycoside mnemonics, then you will get. So the aminoglycosides, what they say that the tanks is the tagline, means the tobramycin, amikacin, neomycin, gentamicin, and streptomycin, TANGS. So that's the way how to remember all these antimicrobial agent. Thanks and amino. So amino glycosides, amino. A means against aerobic, gram negative, mainly bactericidal. Then inhibit protein synthesis. I means inhibited protein synthesis at 30S. Then it is N means nephrotoxic. Then O means ototoxic. So against aerobic, bactericidal, acting on 30S, and nephrotoxic and ototoxic. So by this way also you can remember. And the side effects, especially the oto and nephrotoxicity, side effects of aminoglycosides include nano, means neurotoxicity, allergic reactions, nephro, and ototoxicity. Just to remember, this type of the codings can be done by you all as you are remembering the cranial nerves, like this O cube T square, O cube, ocular, olfactory, etc., and trigeminal trochlear, like that. You can make your own customized mnemonics and remember all the drugs. So this is a flow chart, how the different forms of the aminoglycosides are formed, and what is the structure activity relationships. Here amino sugars are linked with the glycosidic link to amino modified sugars with the glycosidic bondage. Whereas the different forms of the aminoglycosides are the individual, then some of them are the chemically modified and conjugated with other active form with chemically similar agents, and the mobilization with the nanomaterials are also done. See, nano amino acids are done, especially this is based on antibiofilm and antibacterial activities of aminoglycoside toward the pathogenic bacteria. So the mechanism of action of these drugs is very simple. Number one, in very, very broad sense, what we can say is these drugs are the protein synthesis inhibitors of bacteria. That is the broadest classification. Cell wall synthesis inhibition is the beta-lactamines, whereas the protein synthesis inhibitions is by the aminoglycosides, of course, the amphenicols, then also the macrolides and the tetracyclines. So all these are the synthesizing the proteins will be inhibited, especially in the gram-negative microorganisms. Whereas the bactericidal action is concentration dependent. They produce greater cidal effect through high concentrations, whereas low concentration, they are not. And another thing is their efficacy also depend on the high oxygen tension in the environment that require they are effective very especially on aerobic bacteria, because they require the oxygen tension, especially in the environment. So the action of the aminoglycosides is divided into two processes, namely, number one, entry of the aminoglycosides into the bacterial cell and binding up of the amino acids to the bacterial ribosomes. So the same were also discussed in the earlier antibiotic groups, especially the tetracyclines and also the macrolides. So to act on the bacterial cell, they need to first enter the bacteria. So then they need to bind with the aminoglycosides to the bacteria is concerned. So just you need to enter the college, and normally I can give, you need to come to the classroom and sit in the classroom and hear the lecture. That's how the mechanism goes here. Then coming to the first one, that is the passage of the aminoglycosides into the bacterial cell. Then first entry of aminoglycosides in the bacterial cell is a very complex process. Of course, for the convenience, it has been divided into two main steps. So the first, the antibacterial drug need to enter the bacteria. It has got the different processes, passage across the cell wall. So the gram-negative bacteria also have got the cell wall and the passage across the cell membrane. There are two processes, especially in the bacteria. here you can see the mechanism of action in very short. Anyway, we are going to see it in detail later. So this is the direction of how this mRNA moves, and the different amino acids are these are attached, these amino acids, and they need to form the polypeptide chain, especially with the help of the peptidyl transferase enzyme. So these are all the growing peptides chains, and this is 50S and 30S ribosomal subunits. So this aminoglycoside is going to bind with the 30S subunit of the bacterial ribosomes and blocks initiation of the protein synthesis here. So the initiation of the proteins is very much required. Then the here, and also the amino acid block the further translation and elicit premature termination. So the formation of immature or incomplete this peptide blocks will be formed, and because of this thing, the deformed chains will be formed. And the another process is incorporation of incorrect amino acids. So this mRNA will decode for the, instead of alanine, they are bringing glycine. So glycine is not required for the bacteria, and hence a defective peptide chain will be formed, and hence the bacterial protein synthesis will be inhibited. That's how they say. So coming to the second thing, that is the passage of the, especially the cell wall. You know that the gram-negative bacteria and positive bacteria, both of they got the bacterial cell wall, whereas in case of gram-positive, it's very thick and it has got the peptide glycan chain. Whereas in case of the gram-negative bacteria, the cell membrane is present and a thin cell wall is present. So the outer coat of this contains, especially gram-negative bacteria, contains the periplasm. That's the first step. This occurs in the concentration dependent manner via the aqueous channels. They are also known as the pouring channels. Pouring channels, you have seen all these things, especially in case of gram-negative. Yeah, passage across the cell membrane is the second step, and aminoglycosides are carried from the periplasmic. Yeah. So it is going to periplasmic place and occurs with the help of the O2 dependent process. So this is a energy dependent process which linked to electron transport chain, and the oxygen dependent transport system occurs in two phases, that is the phase 1 and phase 2 mechanisms. Then phase 1, the ionized aminoglycosides, they interact with the anionic component of the cell membrane. Anionic means positively charged in a concentration dependent manner. So the acidic environment promotes these interactions by increasing the extent of ionization of aminoglycosides. So as the aminoglycosides are having the basic structure, they will be effective in acidic environment, and increasing the extent of ionization of the aminoglycosides. So especially in case of the cattle udder, when it is having the mastitis, it will turn to as this alkaline pH. Hence, the gentamicin and other drugs are not acting there properly. So increasing the extent of ionization by the amino acids. So the cations like the magnesium, calcium, etc., because these are all the anionic ions. So the cations like magnesium plus and calcium, they retard the interaction either by combining with anionic sites of the membranes by repelling similarly charged aminoglycosides. So the cations, magnesium, calcium, etc., that's also divalent cations. Monovalent and divalent, you know. So they will combine with the anionic sites on membrane by repelling similarly charged aminoglycosides. So that's how one of the mechanism of resistance. Whereas the phase 2, the aminoglycosides are transported actively across cell membrane into the cytoplasm by the carrier mediated system. Here one carrier is required. So the penetration across the cell membrane is favored by the high pH, means the alkaline pH, and some aminoglycosides are many times more active in alkaline pH than in the acidic medium. So they are effective against the bacteria which can survive in the alkaline pH rather than the acidic pH. So the anaerobic environment inhibits the oxygen specific carrier transport system. Yes. The anaerobes and facultative anaerobes are inherently resistant to the aminoglycosides. Means the anaerobes which require 100% of the oxygens without the oxygen, whereas the facultative means they also require a partial portion of the oxygen for their growth. So they are inherently resistant to aminoglycosides. Such type of the bacteria, we'll see what are all those bacteria. So here is the diagrammatic representation how these aminoglycosides are going to act. And first of all, we should remember that the aminoglycosides are going to act on the 30S subunit of the ribosome, and this is the 30S subunit of the ribosome, and the mRNA is the one which codes different amino acids like the guanine, cytosine, and so many other amino acids are joined together to form the polypeptide chain. So what these amino acids will do, especially in the bacteria, is they are going to bind with the A site, then they are going to bind the leucine moiety with that of the methionine moiety. So because of this thing, the wrong amino acids are formed, so which are totally useless to the bacteria. Hence, the bacteria will die or its growth is arrested. So that's the basic molecular mechanisms. Then the second one is the interacting with bacterial ribosomes and the inhibit the protein synthesis. So they are going to inhibit the protein synthesis ultimately, especially of the bacterial protein synthesis. So the aminoglycosides can bind with the 30S and 50S ribosomal subunit, although their binding with 30S is more stronger when compared to the 50S. So please remember that the aminoglycosides are going to do the antimicrobial act by binding to the 30S, but they also partially bind with 50S subunits. The binding force is very high in case of 30S and low in case of the 50S. And by binding to ribosomes, this affects the number of steps in protein synthesis. And we have learned especially this in case of the macrolides are concerned. And interference with the formation of the initiation complex. So that's the first step, especially in case of the generation of the polypeptide chain. So they are going to inhibit the initiation complex. And another thing is the distortion of the mRNA codon, resulting in the misleading of the codon, and this causes incorporation of one or more the incorrect amino acids. So it should be in a very sequence, that alanine, glycine, etc. Then instead of alanine, it's going to put cytosine or many more especially the amino acids, wrong amino acids, especially in the side chain. And the peptide chain, then abnormal proteins are formed, which are not required by the bacteria and cannot be utilized by bacteria also. So the promotion of premature termination, translation with the attachment of the ribosomal complex occurs, and the polysomes are combined with two monosomes, and this leads to incompletely synthesized proteins. Number one, incorrect amino acids. Second one, the incompletely synthesized proteins with deficiency of some amino acid. So there is evidence that these aminoglycosides inhibit ribosomal translocation, whereas the peptidyl tRNA moves from A site to P site. So they are going to inhibit this particular step, that's the translocation. And the aminoglycosides vary in the affinity and the different degree of binding with that of the microsomes, especially the ribosomal ribosomes, and also differ affecting various steps in especially the bacterial protein synthesis. So what happens, the binding with the 30S or the 50S complex? So it is attached with two type of the ribosomes, 50S and 30S, whereas in case of human, it is 60S and 40S. The bactericidal effect is in contrast to bacteriostatic drugs which bind to single ribosomal subunit. So you remember that aminoglycosides are going to bind with both subunit of the ribosomes, whereas the high affinity is towards 30S, and the cidal action appears to be based on their ability to bring secondary changes in the integrity of the cell membrane, especially integrity of the cells. Then the energy dependent transportation of the aminoglycosides across the cell membrane and may occur due to the incorporation of the defective proteins. So these proteins cannot be utilized by the bacteria to form another bacteria, because these proteins, high proteins, are required for the bacteria for the replication process. So that will be inhibited, and hence the bactericidal action occurs. So you may ask the question, the macrolides are also going to bind with the 50S, and also the other drugs are also going to bind with that of the protein synthesis, especially ribosomes. But they are all bacteriostatic. The amphinicols, even though they are very highly effective, the amphinicols and cephalosporins, not cephalosporins. This chloramphenicol, amphinicols, and many more, they are going to bind with that of the 50S and cause the bacteriostatic action, whereas the aminoglycosides are bactericidal action because they are going to bind with 30S and 50S subunits. So the secondary changes are induced during the energy dependent transportation of aminoglycosides across the cell membrane and may occur due to the incorporation of the defective proteins in the membrane. That's the greatest thing, especially the defective protein. So it is not at all used for the bacteria. Then all these result in membrane that is more permeable to ions, amino acids, and even proteins which leak out of the bacterial death. So once the cell structure is damaged, means it will be burst out in the normal body fluid condition. So the altered permeability also leads to the augmentation of carrier mediated entry of aminoglycosides, especially in the cell membrane, and reinforce the lethal action. So here the permeability will be changed because of the bacterial cell membrane deficiency or defect, and this is to be the lethal action to the bacteria. And the important antimicrobial features of the aminoglycosides, the bactericidal action is the concentration dependent. As the concentration increases, the capacity increases. So they should be given in a single large dose instead of the divided doses, because the high doses will have more and more efficacy, and they are more effective against rapidly multiplying bacteria. Some of the bacteria like the E. coli and Klebsiella, they are having the very high growing capacity, very fast. Then show a long concentration dependent antibiotic post-antibiotic effect So, after withdrawal of the antibiotic also, it will sustain in the bloodstream. This is called as the post-antibiotic effect. And the strong and irreversible binding to the ribosomes, it is very long. Therefore, despite the short half-lives in a single injection of total daily doses may be effective, one single dose. Why we are administering the multiple doses is to maintain the peak plasma concentration, or at the site of the action, minimal inhibitory concentration should be there. Whereas here it is not required, only the single dose can also make the animal to recover. And it shows synergistic with beta-lactam, and hundreds of examples we can give. And because of the cell wall injury caused by the beta-lactam, it facilitates the increased uptake of the aminoglycosides by bacteria, and hence they are easily accessible to bacterial cell membrane. That's why the streptomycin is combined with the penicillin, which is a classical beta-lactam antibiotic, and causes the cell wall injury, and this increases by the penicillins, and this is due to the increased uptake of the aminoglycosides by the bacteria, and hence their easier accessibility to bacterial cell membrane. And some aminoglycosides are transported into more efficiently across the bacterial cell membrane than others, and hence they tend to have greater antibacterial effect. So few of them, especially the advanced generations, the broader spectrum antibiotics, they cross the bacterial cell membrane easily. So here the mechanism is dealt in detail, we'll see.
Hi everyone. Today we will discuss about the protein synthesis inhibitors. Whenever we use the antibacterial agents, these drugs are going to inhibit the bacterial growth, otherwise they are going to kill the bacteria, so there may be either bacteriostatic or bactericidal. But this bacteria is going to present within the host, that is the mammalian cells, so antibacterials can also produce some toxicity to the host. Therefore, we have to select the antibacterials such that they are going to produce a selective toxicity to the bacteria only without producing any toxic reaction in the host. So we have to observe any differences between the bacteria and host such that we can target the bacteria specifically by using the antibacterial agents. Proteins in the bacteria are somewhat different from the eukaryotes, which can be used as a point of difference for the action of many of the antibiotics. So today in this video, we will see the different types of drugs acting on the protein synthesis within the bacteria. In the eukaryotes, the protein synthesis is going to be carried within the ribosome, but this ribosome is made up of two subunits, which are 60S subunit and 40S subunit. So totally it is a 80S complex, which is made up of 60S subunit and 40S subunit. But in the prokaryotes or in the bacteria, the ribosome is made up of two smaller subunits, 50S subunit and 30S subunit. So totally it is having a 70S complex, which is made up of 50S plus 30S subunits. So this is one of the important point of difference between the eukaryotes and prokaryotes, which can be used to target the bacteria specifically, such that the drugs produce a less toxicity to the host cells. And if we see the steps in the protein synthesis, in the eukaryotes, protein synthesis is observed with three steps. One is the initiation, elongation, and termination. So now with the prokaryotes, we can also observe the same steps like the initiation, elongation, as well as termination. But if you see the process in the eukaryotes, the process is somewhat more complex, involving the more number of initiation, elongation, and termination factors compared with the prokaryotes. That's why many of the antibiotics can specifically acting on the protein synthesis within the bacteria, and many of the drugs are going to affect the elongation process within the bacteria. So today in this video, we will see the different types of drug targets acting on the bacterial protein synthesis along with examples in that category. So first of all, let us see what are the important steps in the bacterial protein synthesis where the drugs are going to act. Already we have discussed that the bacterial ribosome is made up of two subunits. One is the 50S subunit and second is the 30S subunit. This 50S subunit is having the three important sites, the A site, B site, and E site. A site is nothing but the attachment site where the tRNA is going to be added. And P site is the peptide site where the peptide chain is going to be elongated. And E site is the exit site from where the vacant tRNA is going out of the ribosome. In this way, the tRNA is going to be attached to the 50th subunit of the bacterial ribosome. And within the 30th subunit, we can observe the mRNA, which is having the number of codons, each codon specifying to a particular amino acid. Now here we will see the important steps where the drug targets are going to act. So one of the important steps in the initiation is the formation of 70S initiation complex. So within the bacteria, the 30th subunit is attached with the mRNA along with the initiator codon, the formyl methionine. This 30th subunit is then going to form a complex with the 50th subunit so that it is going to form a 70th initiation complex. After this step, it can undergo the elongation step, then it can start the protein synthesis. Attachment of tRNA. Now, one of the important steps in the protein synthesis is the attachment of tRNA to the 50th subunit. So here the tRNA is going to bring the each amino acid, but the tRNA is current to aminoacyl tRNA, which is the active form of the tRNA. Then this tRNA is going to be attached to the A site where it is going to match with the codons present on the mRNA. So the first step in this protein synthesis is the attachment of the tRNA to the A site where it is going to bring the each amino acid. And within this step, we can observe the codon-anticodon pairing, which recognizes the what are the amino acid according to the codon present in the mRNA. Next step is the transpeptidation. Now, two amino acids are present on the P side and E side. These amino acids should be converted to a peptide chain, and that process, the transpeptidation. So here the peptide chain which is present at the P side is going to be transported to the A side, and it is attached with the amino acid already present on the A side. This reaction is going to be mediated by one of the enzyme, peptidyl transferase enzyme. So this is one of the important steps resulting in the elongation of the peptide chain. Next one is the translocation. So here already the peptide chain is going to be formed by transpeptidation. Now this peptide chain should be transported to the P side so that the new tRNA is going to be attached to the A side. So this is the translocation. So in the translocation, the peptide chain is going to be transported from the A side to the P side so that the new tRNA can attach to the A site. So these are the important steps where the drugs can act. Now let us see the different types of drug targets acting at the different steps in the protein synthesis. So one of the important steps in this protein synthesis is the formation of the 70S initiation complex. The 30th ribosome is ready for formation of a complex with the 50th subunit, but here the linezolid is one of the drug which is going to inhibit the formation of 70S initiation complex. Linezolid is one of a drug belonging to the oxazolidinone, which can inhibit the 70S initiation complex. Step 2 is the attachment of the tRNA. Now to this bacterial ribosome at the 50S subunit, the tRNA is going to bring the new amino acid. But here we have one of the category of drugs, tetracyclines. Tetracyclines are going to bind to the 30th subunit. That means they are going to be attached to the smaller subunit of the bacterial ribosome. Thereby, they are going to prevent the attachment of the tRNA. So whenever the new tRNA is going to be ready for attachment at the A site, it will try to attach at the A site. But because of the tetracyclines, it cannot be attached, as the tetracyclines are going to inhibit the attachment of the tRNA to the A site. In this way, tetracyclines are going to inhibit one of the important steps in the protein synthesis, the attachment of the tRNA to the A site. But here the tetracyclines are not binding to the 50th subunit, they are going to bind to the 30th subunit. So now if we see the different types of drugs in this category, one is the tetracycline itself, then oxytetracycline, chlortetracycline, they have the suffix tetracycline. Similarly, demiclocycline, doxycycline, minocycline, limecycline, these drugs are having the suffix cycline. And particularly here, doxycycline and minocycline are the two drugs which are having the more oral bioavailability, and they can also cross the blood-brain barrier. So in the related category is the glycylcycline. So one of the drugs in this category include the tigecycline. This tigecycline is just acting like the tetracyclines. Step 3 is the codon-anticodon pairing. The mRNA is present with the 30th subunit, and this mRNA will have the codons which will influence the incoming amino acids, where each codon is going to specify a single amino acid. Now we have the drugs like the aminoglycosides. These aminoglycosides again can bind to the 30th subunit, so they can inhibit this 30th subunit, and they may prevent the assembly of the 50th subunit with the 30th subunit. In this way, aminoglycosides can inhibit the assembly of the 50th subunit with the 30th subunit by one mechanism. Aminoglycosides can also act by another mechanism. They can promote the assembly of these 50th and 30th subunits, but aminoglycosides, once they are going to form a complex with the 30th subunit, they will inhibit the codon-anticodon recognition. So whenever a tRNA is going to bring the new amino acid, this tRNA is going to be binding with the A site, but here this anticodon is not recognized with the codon. So the codon-anticodon pairing is not promoted because the aminoglycosides are going to inhibit this pairing. Because this amino acid is not recognized, the amino acid cannot be retained within the A site, so the protein synthesis can be inhibited. In this way, aminoglycosides are going to produce the codon-anticodon mispairing. So we have different types of aminoglycosides like the amikacin, which is having the suffix casin, only one drug having this suffix. Similarly, other drugs like the gentamicin, netilmicin, sisomycin, all these drugs are having the suffix mycin. Similarly, other drugs like the kanamycin, tobramycin, streptomycin, paramomycin, all these are having the suffix mycin, mycin. And neomycin, framycin, two of other drugs. These two drugs are particularly useful for the topical purpose. All these are the aminoglycosides acting by inhibiting the codon-anticodon recognition. Step 4 is the transpeptidation. So chloramphenicol is one of the drug which is going to inhibit the transpeptidation. This chloramphenicol can interact with the 50th subunit. Till now we have seen the drugs are going to interact with the 30th subunit like the aminoglycosides as well as tetracyclines, but the chloramphenicol is going to interact with the 50th subunit. This chloramphenicol forms a complex with the 50th subunit, thereby it inhibits the peptidyl transferase enzyme, so that this peptide chain which is present on the P site cannot form a peptide linkage with the amino acid at the A site. So in this way, chloramphenicol inhibits the transpeptidation by inhibition of the peptidyl transferase enzyme. And this chloramphenicol can also inhibit the mitochondrial ribose in the mammalian cells, so it can produce some gray baby syndrome in the children because it produces cyanosis and reduce the oxygen supply in the infants. So chloramphenicol should not be given to the infants because it produces the gray baby syndrome. Step 5 is the translocation. Now, one of the important steps in the protein synthesis is the translocation, where the peptide chain which is present at the A site, it should be transported to the P site so that the new amino acid is going to be attached at the A site. So here one category of drugs are the macrolides. Macrolides again bind to the 50th subunit just like the chloramphenicol, and they inhibit the translocation. In this way, by formation of a complex, the peptide chain cannot be translocated to the A site to the P site, and protein synthesis can be inhibited. So the macrolides mainly include the erythromycin, they're having the suffix thromycin. Similarly, clarithromycin, azithromycin, and spiramycin, all these are the macrolide antibiotics. And ketolides like the telithromycin is also inhibiting the translocation. And we have the other drugs like spectinomycin and fusidic acid, one of the lincosamide, clindamycin, all these are going to inhibit the translocation. Particularly the macrolides, clindamycin and chloramphenicol, all these are going to bind to the same site at the 50th subunit, thereby they interact with each other. Step 6 is the premature termination. So during the protein synthesis, every time a new amino acid is going to be attached at the A site, but here we have one of the drug puromycin. This puromycin is just acting like a stop codon. It is having some structural similarity to the tRNA, which acts like the stop codon. So whenever this puromycin is going to be attached to the A site, this can act like a stop codon and it inhibits the protein synthesis. Now, when the puromycin is going to be attached at the A site, the peptide chain which is present on the P site can be transported to this puromycin and form a peptide linkage. But since the puromycin is acting like a stop codon, this peptide chain is not attached with the A site and it immediately detaches from the A site. So now it is going to start having the properties of a protein. So protein synthesis can be inhibited. Mature termination of the dalfopristin can act and can inhibit the protein synthesis. Again can bind to the 50S subunit. Thereby they can form a ternary cryptogramins which antibiotics which are good phenicol, linezolid.
So here he has dealt most of the mechanisms, especially the particularly the aminoglycosides, and starting from the especially tetracycline to the end. So this is about the aminoglycoside mechanism of action. So you can go through the different slides once again for the understanding. And so tomorrow we will see the antibacterial spectrum at 2 o'clock. Thank you so much for this particular seminar is concerned, and we'll stop sharing.